Hello, welcome back. My name's Adam Rosen, and for those of you that haven't watched some of my other videos, I'm a fellowship-trained orthopedic surgeon who specializes in knee replacement. So today, with the ongoing coronavirus pandemic, there's actually been some studies showing that there's been a 50% decrease in people actually looking and searching for knee problems, but that doesn't mean that people don't have knee pain, and that also doesn't mean that people don't have knee replacement surgery scheduled. Possibly yours was delayed. But more than ever, we're seeing a lot of same-day discharges, and patients are getting out of the hospital quicker and sooner. And one of the most important parts of knee replacement is the rehab. So what I want to do today is tell you and explain to you and show you some of the best ways that you can get the best out of your total knee replacement as far as getting the best range of motion, shortening your recovery, and decreasing your pain. So the thing that I explain to all of my patients over and over again, both in my handouts and in the office and in the hospital after surgery, is that the most important part of your rehabilitation is in the first 6 weeks. It is really important and almost imperative that you do all of the exercises and all of the therapy to get the best range of motion. Not only does that motion lead to a better outcome, but it can shorten your recovery and it can decrease your pain. And a lot of that, to be honest with you, I've learned over the years. I've been in practice over 15 years, and I've seen a lot of second opinions. I've met a lot of patients that are 2 and 3 years out from surgery, and they consistently have had pain, and they've had very limited range of motion. And 99% of the time, I don't see anything technically that was done wrong by the other surgeon, but in talking to those patients and listening to their stories, what I've heard is that a lot of people either had a lot of pain, or they didn't understand the importance of rehabilitation, or they had difficulty doing the rehab, so they stopped thinking, I'll do this later. I'll do it when the pain decreases, or I'll do it once the swelling goes down. And what I try to explain to those people is that that time was in the beginning. Even though it was painful and even though it was sore, the most important part to get the best outcome out of your knee was in those first 6 weeks. And all of those patients, they look at me and they tell me they wish they would have known a lot of this information that I'm going to share with you today, because if they knew, they would have worked harder, or they would have pushed more, or they would have kind of pushed through the pain. And that's the important thing that I try to explain to people, is that you got to push in the beginning. Now, what's interesting is that counterintuitive to what our mind might tell you is that when you start to bend and straighten your knee, it's actually going to hurt less, not more. And if you think back to your arthritic knee, a lot of people, they'll notice after a while that the knee gets painful and stiff when you don't move. And once you get up, it may hurt the first few steps or the first few bends, but if you start to move it more and more, the pain diminishes and decreases and goes away. And people find that if they keep moving throughout the day, they actually feel better. It's the same thing after knee replacement surgery. Like I always tell my patients, you're not sick after knee replacement. Think of it like a sports injury. Got to get up, you got to walk it off. The people that go home, the people that lay in bed, the people that get a hospital bed, the people that have very caring friends and family that do everything for them, bring them all their food, help them lift their leg, do the worst. The people, and there's actually some interesting studies that have shown the people that live alone actually do better, because you're doing what's called your ADLs, your activities of daily living. You have to cook, you have to clean, you have to go up and down the stairs. And those simple things of bending and straightening and walking actually improve your rehabilitation. So, most important thing in the first 6 weeks is range of motion. So what I explain to people is when you leave the hospital, you should be able to sit with your knee at a right angle, which is what we call 90 degrees. So it's a 90-degree bend. Think of building a box and putting your leg up against that box. At 2 weeks, you should easily be at 100 degrees of bend. And at 4 weeks, you should be at 110. And at 6 weeks, you should be at 120. So it's just a guideline to let you know, are you moving in the right direction? And if not, how far behind are you? Because not everybody will wind up with the same range of motion. Implants today will allow you a lot more motion than most people will ever get. But the most important predictor of your range of motion after surgery is how much motion you have before surgery. So if somebody can barely bend their knee, the tissue around their knee is tight. That person is going to have to work a lot harder, but they still can make great gains in motion. If you've had excellent range of motion, you may be able to get all that back, but again, you have to work hard. So the other two common things that we see after surgery not only are pain, But also the sleeping issues. A lot of patients have difficulty sleeping for the first 6 or 8 weeks. And we're not really sure as to why. A lot of it leads to stiffness. And what people find is once they get up and walk around at 2 in the morning, the stiffness goes away, the pain goes away. What I have found over the years is that your pain will decrease as your motion increases. And your ability to sleep through the night will improve as your motion increases. So it is really important and imperative that you do these exercises to get the best range of motion, because your sleeping is going to improve and your pain is going to diminish. So just understand that it will not make your knee worse by doing these exercises. And I always tell people, you cannot hurt your knee in bed. I've never had any patient bend and straighten their knee in bed and damage the knee or worsen the problem inside their knee. They've not popped stitches. Now, people can fall. It is rare, but I've had a few patients over the years fall, and that can do damage to the incision. But don't be afraid that bending and straightening your knee will damage the implant or damage the skin. So one of the other things that I do to all of my patients is I take a picture during surgery. So once surgery is done, the knee's bent, I lift their leg up, let gravity bend their knee, and I take a picture. And I give every single patient after knee replacement surgery that picture. It's something that you could even ask your doctor to do. It may be something that they haven't thought of, and something that is simple, something that is inexpensive. But what I find is when those patients see that picture, it allows them to know that they can bend it fully. They see the knee and the picture bent all the way back, and it lets them know that if they bend it, even though it hurts, they're not going to break it. They're not going to do damage. So it's really, really important thing. So the first 6 weeks are key. When you leave the hospital, 90 degrees of bend. At 2 weeks, 100. At 4 weeks, 110. And at 6 weeks, 120. And you may be able to get more, but that should be a good guideline. Now, the other thing that I don't have here in my house, but what I want to explain to you is one of the best other exercises that you can do at home if you have access to it is a stationary bike. So this can be either a sit on top or a recumbent. And what I tell a lot of people, as soon as you go home, first day, get on the bike. Not for aerobic exercise. You're not working up a sweat, but to loosen up your knee and to do rehab. So you might get on it for 2 to 5 minutes, 3 times a day. And what you're going to do is get on and pedal, pedal, pedal. And we're not really sure why. A lot of people find that they can go backwards easier than forwards, and that's okay. But get on and pedal, loosen up the knee. It will improve your knee function for the next few hours. But to improve your bend, what I then have people do is once you're on it, say for 2 minutes, get off, drop the seat down 1 click. Or if it's a recumbent, move the seat 1 click closer to the pedals and pedal again for 30 seconds. Then stop. Drop the seat down again, move the seat forward, pedal again for 30 seconds. You might move it a 3rd time and find, I can't get all the way around. It just goes back and forth and back and forth. That's okay. It just lets you know that you can move it 2 clicks that day and you stopped at 3. So in a day or 2, now you can move it 4 clicks and you get stuck at 5 clicks. So it gives you this way of figuring out how much improvement you've made. Okay. Now, the last thing I'm going to show to you are the 2 simple basic exercises that I have every single one of my patients do. I give them a handout with a written step-by-step, but I also explain this to them in the office at the pre-op, and I go over this again with them in the hospital on the day of discharge. I tell patients, and everybody needs to do this, which is why I'm doing it in the kitchen at the end of each meal. So breakfast, lunch, and dinner, you're going to do 1 1-minute straightening exercise, and you're going to do 1 1-minute bending exercise. If you have difficulty getting straight or bent, I will have then patients do it every hour on the hour while you're awake. And it's amazing. If I have somebody that's struggling with the bending at 2 or 3 weeks, patient lets us know, or we track it electronically, or we talk to a home therapist that says, this person's really struggling with the bending. I will tell the person, listen, do it every hour on the hour while you're awake for a week or 2. And it's amazing. That person will catch up and sometimes even get ahead because you have to get the joint moving. And if you get the joint moving, you decrease the risk of scar tissue developing, which will be permanent. We do have ways of trying to improve people's motion. You may have heard of somebody getting stiff and needing to go back to an operating room to be put to sleep, where we physically and manually bend the knee and break up the scar tissue. It's called a manipulation under anesthesia. It is painful, and it doesn't make your knee normal. It just improves from where you were. But you could have been better if you had done the rehab in the beginning. So here we go. So we're going to show you 2 exercises. I'm going to show you 1 straightening and 1 bending exercise. Okay, so for the straightening exercise, this is a 1-minute exercise. You're going to do it 6 times, each one for 10 seconds. So what you'll do is you'll take your foot, you'll put your foot up on another chair or stool in your kitchen, trying to have your heel there, knee resting in space. What you'll find a lot of times is when the knee is tight and swollen, it doesn't want to straighten all the way. So your job is going to be 2 things. You're going to use this muscle, your quadriceps, to push your knee as straight as possible. You can think of it as firing your quad, pulling your kneecap up, or pushing your knee down. But you want to make sure that this muscle fires. If this muscle fires, it's going to automatically relax the muscle in the back of your knee called the hamstring. You don't think about it, but when you lift up a jug of milk, you pick up a jug of milk, your tricep has to automatically relax because your bicep is firing. And the same thing happens in the leg. So number 1, quad pushes your knee down. Take your hands. Typically, I'll have people make 2 web spaces above your kneecap, usually above your incision, and also push down with a pound of 2 of pressure. Most knees should bend backwards about a degree or 2 to lock straight. So if you're standing in line, you can lock the knee straight. And you want to push down, hold it for 10 seconds, count in your head or watch a clock, and then relax. Catch your breath. Number 2, quad push. Push with your hands. Hold it for 10 seconds. Relax. Push, push, hold, 10 seconds, relax. And you're going to do this again 6 times. Each hold will be for 10 seconds, so it's your 1-minute straightening exercise. Okay, so here is the 1-minute bending exercise. What you're going to do is start. Your foot will be out in front of you. You can have a sock on, or you can use shoes if your foot starts to slide on the floor. But what you're going to do is you're going to take your foot and you're going to slide it back. Notice I'm getting my knee close to 90. Then what you're going to do is you're going to take your butt and you're going to scoot your butt forward in the chair. See how the knee bends more? This will feel tight. You're going to hold this position for 10 seconds. And then you're going to sit back to where you started. But you're not going to move your foot forward. Stay in this position. Catch your breath. Take your foot. Slide your heel back again as far as it goes. And then take your butt, scoot your butt forward in the chair again. The knee bends some more. Hold this position 10 seconds. Then sit back. Again, don't move your foot forward. Slide your foot back again a 3rd time. Scoot your butt forward again. Hold it for 10 seconds. It will feel tight. Then sit back again. Now, on the 4th, 5th, or 6th time, there's 2 important things to look out for. One is you may not have the strength or ability to pull your foot back anymore. So you can either reach over, take your hands and manually push it back, or you can take your good leg, hook your ankle in front of your knee, and force it back. And then slide forward again. Hold it for 10 seconds. And then sit back. The last thing to keep an eye on is if you get it on the 5th or 6th bend, you get it quite far back, and you slide your butt forward. People have a tendency to lift this butt cheek up because it hurts and it unbends your knee. Notice that there's less bend when I lift up like that. You really want to make sure that you can sit as flat as possible to get that knee bent. Hold it 10 seconds, and then relax. Okay, there you have it. It's all the important information that you need that's going to really help you not only improve the range of motion in your knee, but decrease your pain, shorten your recovery, and improve the outcome of your knee replacement procedure. There's lots of other ways of doing physical therapy. I always tell people we do make a big deal about physical therapy, but don't overthink it. I mean, in reality, your knee essentially does 2 major things. It straightens and it bends. So every exercise that you get in a sheet from a physical therapist, online, from a friend, is all going to be either a straightening or a bending exercise. You can do it standing up, you can do it lying down, you can do it on your belly, you can do it on a bike, you can do it in a chair, but you have to do it. Again, the most important thing is to get early range of motion. This is one of those times in life that you only get one chance. If you don't do this and you do get stiff at 6 months or a year, there's not going to be a physical therapist or doctor or surgeon that can make a significant improvement in your range of motion once that scar tissue becomes permanent. So if you choose to go through knee replacement, Put 100% of your effort into your physical therapy, especially in those first 6 weeks. It's your full-time job, 7 days a week. I kind of joke with people that, if you were playing an instrument and your piano teacher showed up once a week, or in this case, your therapist might show up twice or 3 times a week, and you didn't practice for that whole week playing piano, and your teacher came back, you still stink at playing piano. But if the teacher shows up, like your therapist shows up, and you do these exercises multiple times a day, in a week, you come back and you are so much better. And then they can advance you. They can give you more exercises because the whole goal is to get back to living your life with a better knee and without pain. But the only way to get there is to do these exercises. So work hard. Again, early range of motion is key. When you leave the hospital, 90 degrees of bend, 100 at 2 weeks, 110 at 4 weeks, 120 at 6 weeks. Keep moving regularly. Don't sit for too long. If you are lucky enough to have access to a stationary bike, sit on a recumbent, get on the bike at least 3 times a day just for a few minutes to pedal and move that seat closer each time because that's going to help with your range of motion. Ask your surgeon if they would be interested or willing to take a picture of your knee in the operating room after surgery just to prove to you and your mind as to how much your knee will bend and that you're not damaging it by bending it back further even when it hurts. And then the other most important thing that I think for all of my patients for them to do to get the best range of motion is those 2 exercises I just showed you. The one straightening and the one bending exercise. At minimum, 3 times a day while you're sitting at your kitchen table after your meals. But if you notice that you're getting stiff, maybe in one direction or the other, it may just be straightening or it may just be bending, but do that one exercise every hour on the hour while you're awake. I can almost guarantee that within a week or 2, you're not only going to catch back up to where you should have been, but you're going to be ahead of the game. It's going to improve your pain, improve the function, shorten the length of your recovery, usually improve your sleeping habits, and at the end of the day, give you the best total knee that you can possibly get with the rehab that you put into it. So again, thanks for listening. I'm Adam Rosen. Until next time, stay safe.